Welcome, welcome. Good afternoon, and welcome to the JustUS Coordinating Council Speaker Series. I am DeAnna Hoskins, President and CEO of JustLeadershipUSA and the founder of the JustUS Coordinating Council. The JCC is the first of its kind national policy table created by and for individuals impacted by the criminal legal system. Over the course of last year, we have built a table where everyone is welcomed, invited, and has a seat. A table where collectively we can leverage our lived experience as the expertise it is, and it is an absolute pleasure to be with you today on what is the first of many powerful conversations to come. Today's speaker series features the United States Center for Disease Control and Prevention. They will be highlighting pathways to employment with the CDC, as well as practical tips on how utilizing the USAJobs website and what to expect from the process. I am joined today by our three speakers from the CDC National Center for HIV, Viral Hepatitis, STD, and TB Prevention, Dr. Gia, Senior Policy Health Advisor for Diversity, Equity, Inclusion, Accessibility, and Belonging, Dr. Marlowe, and Correctional Health Coordinator, and Dr. Miles, Epidemiologist for the Office of Health and Equity. Before we dive into today's session, I want to exactly talk about what the JCC truly is and why it's a first of its kind approach. And I'd like to at this time, move the slides along so we could talk about the JCC. So as I stated, the JCC is the first of its kind policy table built by us for us to actually be the linkage connecting the federal government to the communities so that we'll understand what the federal government is doing, how we can actually be included in those processes, and as today's webinar is going to talk about, how we actually access employment, career opportunities within the federal government. Next slide. Again, this table, our why, our voices were missing from policy decisions that take place that don't always require legislative actions, but actually practical solutions within administrative processes within the federal government. So some of our priorities are collateral sanctions, housing, sentencing, employment, and well-being. Today's focus is going to be on our priority of employment. Looking at the employment opportunities that are available within the federal government, as I spoke, the diversity, equity, inclusion, accessibility, and belonging is a executive order from the president for all federal agencies to look within their policies of how they actually may not be inclusive of individuals. And with the Fair Chance to Compete Act that was actually signed into law in the federal government, ensuring that people with criminal backgrounds are not being held back because they have an interaction or a history with the criminal legal system. Next slide. Again, we know that aspects of the expert reentry experience, federal job training programs are disjointed, often inaccessible to individuals returning to our communities, and effectively in helping a diverse group of job seekers move towards mobility. Funding comes from various different processes within the federal government. Distribution of those funds is inequitable, limited investment in small providers, and again, federal employment opportunities may not have been available for individuals with criminal backgrounds. Next slide. So our goal of the JCC is to center the people, center it back to our communities, center it back to on-the-ground action and where things actually take place. Are we available with our panelists at this time to move forward?
Yes, Dr. Gia is with us.
Yeah. All right. Next slide. So now I'd like to hand it over to our panelists. Again, their titles, information is on a slide for you to take note of if you need to talk to anyone afterwards. Good afternoon, Dr. Gia. How are you?
Good afternoon, ma'am. Can you see me and hear me okay?
Yes, I can. Thank you for joining
Great.
today.
Thank you so much. Thank you. I appreciate it. We appreciate having carving out the time for us to join you all today. Um, Next slide, please. So I'm going to dive right in. Again, my name is Captain Neelam Gia. I serve as a senior public advisor for diversity, equity, inclusion, accessibility, and belonging, along with engagement and recruitment for CDC's National Center for HIV, Viral Hepatitis, STD, and TB Prevention. Um, and so I would love to share with you what CDC is and what we can do for you. Um, Next slide, please. So, what is public health? You're asking me, right? We are public health. The Center for Disease Control and Prevention in the United States is a premier health agency, and we ensure healthy people in a healthy world, or as much as possible, right? Public health connects us all. It's the science of protecting and improving the health of families and communities through promotion of healthy lifestyles, research for disease, injury prevention, and detection and control of infectious diseases. And overall, public health is concerned with protecting the health of entire populations. So these can be as small as your local neighborhood or as big as an entire country or region of the world. And so public health professionals, as we are, we try to prevent or mitigate problems from happening or reoccurring through implementation of educational programs, recommending policies, administrative services, conducting research. And so, again, a large part of public health is promoting healthcare equity, quality, and accessibility. And we work to limit health disparities. Next slide, please. So, our mission, again, is to promote health and quality of life by preventing and controlling disease, injury, and disability. CDC works to save lives, protect people, and save American dollars through prevention. And so think of it as a wise investment made in public health, and CDC, along with our partners, that have saved many lives, especially, as you can imagine, in the last several years, from infectious and chronic diseases, environmental hazards, injuries, and emergencies. Um, we at CDC provide emergency response expertise in public health infrastructure, strengthening vaccine development and effective public health actions, and support strengthening our global disease detection. Next slide. So here, I won't click play for you, but if you go on YouTube, there's a quick 2-minute video called CDC 24/7, Saving Lives, Protecting People. And again, if I can, I'll try to drop it in the chat, but it's a quick YouTube video. Feel free to learn more about us there. Next slide. So I wanted to provide sort of a landscape for you. CDC offices spread across 10 regions across the United States and territories. We employ more than 15,000 employees in more than 50 countries and over 170 about occupational categories. And we'll get into that a little bit more later in the presentation. We are headquartered here in Atlanta, Georgia. And as the United States, again, Health Protection Agency, we are strategically placed to get to those health threats as soon as possible. And so when disease start at home or abroad, if they're chronic or acute, curable or preventable, human error or deliberate attacks, CDC is there to fight diseases and support communities and citizens to do the same. Next slide. Here is our current organizational structure, or our org chart, as we call it for short. We are comprised of the Office of the Director that you see in the middle there. And then we have, this is just a good snapshot for you to see sort of the different topical areas that we have, right? So you could see global health, public health preparedness, state and local support, surveillance, epidemiology, laboratory services, non-communicable diseases, injury and environmental health, and infectious diseases. And so CDC's Center, Institute, and Offices, or what we call CIOs for short, allows the agency to be very strategic and responsive and effective when certain public health concerns arise. And so each of these groups implements CDC responses in their area of expertise while also providing interagency support and resource sharing for cross-cutting issues and specific health threats. Next slide, please. And so I would love to highlight my own center because we would love to serve alongside you via the National Center for HIV, Viral Hepatitis, STD, and TB Prevention, NCHHSTP. We speak in acronyms if you haven't picked that up already. Our activities specifically include public health surveillance, disease prevention research, funding grassroots disease prevention programs, developing and promoting harm reduction strategies, advancing school-based health and disease prevention programs, developing data and educational materials to support clinicians, developing communication materials to support disease prevention among highly affected groups. And you can see our web page right there at the bottom if you'd like to learn more. Next slide. So now the section you've probably been waiting for is job opportunities. And my colleagues will be able to share more, but what I will share is sort of what positions are typically open at CDC and our center. And so let's learn how to look at those. Next slide, please. So CDC, our work again to give you a better idea is around improving infectious diseases, outcomes, linkages to care, specifically around disproportionately affected communities, partnering with federal, state, local partners, and for us to end the HIV epidemic and reduce HIV transmission. We also work on STD, tuberculosis, and viral hepatitis to combat those and the disease surveillance and responding to outbreak investigations. And then addressing community health by developing and supporting harm reduction strategies. And an example is a syringe services program, SSPS. We also support teachers and school systems with classroom management skills and strategies to increase school connectedness, improve mental health. And we're really here at NCHHSTP, a vision for a future free of the diseases mentioned. And really, we're interested in developing effective, inclusive, and stigma-free public health interventions. So if that's your thing too, we would love for you to consider joining our team. And so you can see on this page with the link at the very top how to learn more about the different categories here you see on this page. And next slide, specifically here, shares with you the type of positions at our agency as a whole. So again, CDC is a science agency and most of our positions are public health, science, and research related. That is our focus. We do have a wide range of other sort of positions that keep CDC functioning, including jobs that help manage our budget, our contracts, our external partners, workforce and career development, communications, so our websites, and then others who help plan and develop public health programs for communities, right? So I won't read you this list, but we have a QR code that if you go to it, will of course share more information about these. Next slide. And then again, or excuse me, not again, but overall, this is how you apply to these amazing jobs, right? See the application process, and we will, I wanted to just show you this slide for now, but we're gonna do a deep dive into the ins and out of all of this that's being shown on the application process slide on your screen right now. So at a high level, you can see sort of where you would start, which is at USAJobs.gov. That is a platform for where you can apply for federal positions, not just CDC, but also our sister agencies as well. And that is the venue in which you would submit your application and how it is reviewed. So again, we will go into each of those a little bit later in the presentation. Next slide. So what happens after you apply? Again, at a high level, you are then your application is reviewed. You are then referred to the hiring manager of that position. You are then asked to come on for an interview. And at this time, the majority of interviews are virtual. They have been for a while. And then the selection happens if you make the make it to the rounds of interviewing. And then after that, of course, onboarding will happen. So again, just at a high level, wanted to show you those two slides. But at this time, if possible, I would like to pivot over to my colleagues. Dr. Marlowe, I believe this is her slide up next, if she has joined. Oh, sorry, Dr. Miles, please.
Next slide. So, so you're wondering now, what happens once you're selected for the position? You're typically sent a tentative offer. Can everybody see? I can't see myself, but hopefully you can see me. You're typically...
Yeah, we can see you and hear you just fine.
Okay. You're typically sent a tentative offer letter, which basically says that you got the job. Yay. But you have to essentially be cleared by CDC to work for CDC and cleared through the security office. So you're then selected, you're then assigned a security specialist, and you have to complete a bunch of paperwork. This is where you disclose any background information about any history of incarceration or justice system involvement. So, and this is where me and the work of my colleague, Marielle Marlowe, come in. We initially thought that if you had a history of incarceration, that you couldn't be hired or work at CDC. So, but we found that that wasn't true. It was entirely false. And I'm sure many of you also thought that as well. And so, DeAnna, I wanted to ask you, as someone that has worked for the federal government, what were your perceptions about applying to and being hired by the federal government when you first applied? What did you think would happen after you finally got that chance to check that box? What were your perceptions?
Initially, I think I just was throwing my hat in the ring, had no clue, didn't think it would go anywhere. But also, I was in that transition of when President Obama adopted a fair hiring policy within the government. So I always tell the story of I had an application in, and then he made this announcement that individuals' criminal conviction will not be held against them, that all applications will be evaluated based on knowledge, skills, and abilities. And I don't know if it was just coincidence or anything, but a week later, I got the call to actually come for an interview, still thinking my criminal record was going to stop me. So that process of even being invited to do a virtual interview, I decided to fly to DC because I thought it was just going to be my only opportunity. Once they know I got a criminal record, I'm going to be out of the race. But to my surprise, it was my lived experience being connected to the community that I always share with people that actually sold my expertise. And that was at the moment when I realized the core competencies that had transpired in my previous life. And a lot of us don't do this when we put on job applications or resumes. We don't pull out the core comp. We have one resume we send out. Every resume should be catered to the job because you want to get out the portal, right? You want that electronic thing. But it was those core competencies that I pulled out and highlighted on a very extensive breakdown of my resume. Federal government resume should always have 10 years at least. That was something I didn't know. And it wasn't until I learned those skills. But my initial, all the way to the final process, I was in total shock until I got that final letter of offer. I just knew at any day it was going to break down.
Yeah.
And I want to share too, I've been fortunate enough to go into government in 3 ways. One was the career that we talked about as a career position, managing the federal government's investment in corrections and reentry. But then I was able to go back as a consultant. So I went through the process of onboarding with a criminal record as a consultant. And a lot of people within the federal government, security clearances are different based on the work you're going to be doing, the office you're going to be in. So when I was a grants manager in a career, I think I had a trusted clearance where I just needed a trusted clearance. Still had to talk about my criminal background, although I have a pardon. But then when I came in as a consultant and I was at Main Justice, where the AG is, it was another level of security clearance. And then the final one was a fellowship, which actually is a top secret clearance. So when people say what type of criminal convictions, there are mitigating circumstances that all clearances will have to do, Department of Defense does on the individual. And again, top secret, I was like, oh, you kind of made these other 2. Will you get a top secret clearance? And what I discovered was with the top secret clearance, they have mitigating factors too. And one of them is the length of time since the criminal conviction has taken place was really huge. But again, all the way to the final check mark, I was like, okay, at what moment am I going to get the email to be like, your criminal record has prevented you? So the perception, I think, is always there for people who have a criminal background. But my recommendation is to just keep going forward, keep going through, even when it feels like it's going to just all fall out, that we just keep going through. I know Mario is on the line and has joined us, and they said she's ready to speak up. But I have a question for you, Dr. Miles.
Okay.
Why is this important to CDC? We know for people with criminal backgrounds, or at least my perception was, it's easy for me to get at Department of Justice in the various offices they have because the Department of Justice have realized people with lived experience are very key to some of the work that they do. As we're talking about sentencing reform, access to justice, having access to public defense, Second Chance Act, juvenile justice, it makes sense over there. And now to see other agencies like, no, don't forget about us. You guys can apply over here. You can have a career in the CDC. Why is this work important now? And why are you here to share this information out with individuals who have been directly impacted?
I would say this was brought to light, especially during COVID, when, on our task force, we were trying to develop treatment guidelines and guidance and like just all kinds of information that needed to go to people who were currently incarcerated. We realized we didn't have any people at CDC that could speak to that experience of actually living in a jail or prison to provide any expertise on that side of the lens, if you will. So it's important for public health work that is engaged in anything related to correctional health, just to provide assistance with, what happens after you get out of a prison or jail and helping with reentry. Having somebody that has that insight and that expertise is helpful for our public health work. But outside of that, it's just important for DEIAB in general, so diversity, equity, and inclusion, that people feel like they can bring their whole selves to work every day and not feel or experience any stigma based on, their background, whether it's because of the color of their skin or whether it's their religion or whether they have a history of incarceration. So being able to feel included and not stigmatized in the work setting is why it was important for us to just make sure that these voices weren't lost.
And that's very important. I think when we first had the conversation and we were talking about the health in correctional settings, of course, anyone who's been incarcerated, that's the biggest complaint. We talk about food and health. And the fact that the CDC and all the work that you guys are doing, the fact that you're saying we need people who experience it, who has experienced it, to give us input as we're making processes and policies. And for the group, for our people who are attending today, I was thinking when Dr. Gill was talking and when you were talking, that in my hometown of Hamilton County, I just had a call the other day where there's an 80% increase in syphilis. And it's within the population that is homeless, substance abuse, which is recycling through the local jail. So that is key for individuals when we talk about, I think Dr. Gia talked about funding community grassroots to do community healthcare type of work in those settings. This is key to be able to connect the links of how you can actually, even if it's not being employed with CDC because it's a position you don't want, you want to continue to do the grassroots work you're doing. How do you partner with CDC to address the issues that are directly in your community with the correctional population as well? Mm-hmm. So I want to thank you guys for the overview over that, and both the structure of the CDC and the prioritizing of creating equity and inclusion in hiring. I think that's really huge. Again, the perception with people with criminal backgrounds is a lot of times we think we can't because we have a criminal record. And I was one of those, only to find out I could, and that actually my lived experience on top of my career experience made me the perfect candidate for those jobs. For those joining us today, it may be surprising to learn just how accessible many of the federal government jobs are within the CDC. And for those, especially for those of us with criminal records, again, it's one of the things we like to do within Just Leadership and the JCC is demystify all the myths, because everyone has told us what we can't do. So our goal within these speaker series is to say what we can do, not only what we could do personally within our career, but how we can actually have access to partner to be of service in our communities around the works that we do. So I know Mariel has joined us. If we can bring her in. I want to know, Mariel, is she with us?
Yes, she is.
Okay. Mariel, can you hear me?
Can you hear me?
Yes, I know you had to join us by phone, but thank you for still making it work.
I'm so sorry for technical difficulties. There always are some. So I'm the one this time. I apologize. You all can't see me on video, but very happy to be here.
No, thank you. Can you share more about what the CDC is doing to support the hiring and the inclusion of people with lived experience within the organization, kind of building on what Neelam and Renelle has shared for us?
Yes, for sure. And again, thank you so much for the opportunity to be here. And I just want to double check, are the slides up, and are you seeing the slide that says myths and versus facts?
We are on the one, what happened? Yep, now we're on the first one. Yep, you're good to go.
Fantastic. Okay, thank you so much. And so, yeah, recognizing everything that Renelle just described, DeAnna, you describing your experience, what Neelam just covered, in 2022, we saw an opportunity and we took it to advance the hiring and inclusion of people with lived experience at CDC. And that opportunity was in April 2022, the Health and Human Services Secretary made a call for proposals for the HHS Secretary's Challenge on Equity. Renelle and I in our office, we submitted a proposal that was selected as CDC's winning proposal, which focused on the inclusion of people with lived experience with incarceration in the federal public health workforce, which was really exciting to see HHS, Health and Human Service, and CDC leadership supporting this initiative. And so to carry out this proposal, once we were selected to carry out the proposal through the Office of the CDC Director, so at the top, we formed a CDC-wide task force with representatives from across the agency, as well as a diverse range of professional backgrounds. So not just the scientists and epidemiologists like you see on the call today, but also people from human resources, our security office, our communications, policy, employee assistance program. The list really goes on and on. So over the past year, the task force has met twice a month and collaborated with other federal agencies, and as well as JustLeadershipUSA, who have been fantastic partners for us in this endeavor, in this initiative. And so so the initial goal of that proposal, what I was just describing, the initial goal of this task force was to identify and address barriers to hiring people. So looking at the hiring process for people who were formerly incarcerated by creating or modifying a hiring mechanism or recruitment or inclusion strategy. So just as Renelle and DeAnna described, we thought we were going to have to change hiring practices to be able to hire people with lived experience, which turned out as we've already discussed, not necessarily to be the case. And I'll go through a little bit of that in the morning. So now I'm going to walk you through our lessons learned from the task force so far. And to do that, I'm going to show you the myths that we all perceive to be true, as we already mentioned, and then compare with the facts of what we learned at the reality of the hiring process at CDC and really the federal government at large. Next slide. And so just real quick, are you looking at a slide that says people with a criminal record can't get hired?
Yes.
Okay, great. Just to make sure we're getting on that cadence together. Again, apologies for not being able to see the slide. So, the first myth that we came across was, and again, we're kind of turning into a broken record here, but the misperception that people with a criminal record can't get hired at CDC, the federal government. And as described before, we believe that once you have lived experience with incarceration, you just, DeAnna, as you described, the minute you check that box, so someone was going to stop you at some point in time during the process. And as we're now, as the task force ourselves, everyone who was on the task force had this same impression because we all had memories or stories from our extensive USAJobs application and hiring process. For example, I'm a dual citizen and I have a degree from a foreign university, and I got several calls back to the point that I was worried, am I going to get this clearance or not? Because it's an extensive process with lots of questions, and it can be described as really daunting at best sometimes. Or people had heard stories, right? It was myths. We had heard stories of people who were hired and then something came up on their background check and things were difficult. So, we had this even here at CDC, internally, we had these misperceptions. And so next slide. But after discussing with CDC Office of Safety, Security, and Asset Management and reviewing the U.S. Office of Personnel Management policies and updates, we learned that people with history of justice involvement can be hired at CDC, and that there's been recent changes that have improved hiring practices, as DeAnna mentioned, starting with the Obama administration. Next slide. So our first lesson learned is that agency employees or contractors working on behalf of the agency may not request criminal history at the point of initial application. They can't request it upon receipt of an application, and they can't request it prior to, during, or after a job interview. So when applying to the federal government, USAJobs, as Neelam described, and the Office of Human Resources do not collect any information on justice involvement. It's only once the hiring official selects the candidate, so you are fully qualified and you are selected, you apply and you are selected for the position, and you get a conditional offer of employment, that then you're going to get the first questions about history of justice and involvement that are in the required forms during onboarding. So given anyone can apply and be selected for a position without being asked about their criminal history, means the federal government complies with the Ban the Box initiative. And for the federal government, this practice started in 2019 through the Fair Chance to Compete for Jobs Act. Next slide. So then we thought, someone can be selected, they can apply and be selected and offered the position. But then once they start this process, extensive process to obtain their security clearance to be allowed to work at CDC campuses or to be able to access government systems, like the security clearance you mentioned, DeAnna, and then what happened? So again, we had the myth, the assumption that someone who had a history of justice involvement would then be automatically denied a security clearance, and eventually, because they couldn't get a clearance, then denied employment at CDC. Next slide. Well, we discovered that in fact, on average, across the federal government, 1 in 5 selected candidates, so this isn't 1 in 5 people who apply, these are 1 in 5 people who are selected for a position, has prior justice system involvement. And of those, only 2% are denied employment because of that justice involvement. So we found similar statistics when we were reviewing CDC's numbers. We worked with our Office in Safety, Security, and Asset Management and learned that selected candidates with former justice involvement here at CDC, they range from people who were hired for non-public health to public health positions, up and down the pay grade, up and down the pay scale. Their offenses ranged from misdemeanors to felonies, to people who may have just been arrested but not charged, to those who served time in prison. So really a very diverse range of individuals for diverse positions and with diverse backgrounds. Next slide. And so after the hiring official selects the candidate and extends the conditional offer of employment, the Office of Safety, Security, and Asset Management, or OSAM, initiates the suitability and clearance process, which Ronell mentioned earlier. The candidate is asked to complete 2 forms that include, among other background information, questions on their criminal record in the past depending on the level of security clearance, the past 5 or 7 years. And in both forms, the candidate is provided an opportunity to explain their history, so to provide their background and more details about their background. So next slide. I just want to double check. Are we on the slide that says adjudication?
Yes.
Fantastic, thank you. So at the same time that you've filled out those forms, once the process has been initiated, OSAM is then running an FBI background check and combining the FBI background check with what your answers were on the forms that you filled out, which is essentially what we all think of as the background investigation. It's important that candidates still report any charges that were dropped, expunged, stricken from the record, and that's stated in the OPM forms. The OPM forms that you fill out are going to say, please include any charges that were dropped, expunged, things like that. So you just have to make sure you catch those instructions on those forms, because it's still something that's still going to show up on the police or FBI record. Cases with a criminal record are reviewed by the adjudication team, who are guided by OPM documents, defense counterintelligence, and security agency notices. And whether or not a person is deemed suitable for employment is determined on a case-by-case basis. And I know that's something that DeAnna just touched on too. So it all comes, and it's a silent case-by-case basis, because it all comes down to how complex the individual and how complex our criminal justice system is. So it's important to note that the high.
Can I jump in?
Yeah, go right ahead. Yeah.
I want to jump in here really quick, because I think it's important. I was trying to cut my video on, but I think it's important for people to know, when you said even records that have been expunged and pardoned definitely should be included, because this kind of goes to the myth that, expungements, pardons, we have a whole national movement around clean slate. Your record can never totally go away, right? And I think that's important for people to know, because people will think, well, no, this is expunged, it should not be held against me. It won't be held against you, but you have to put it, to be honest, because certain background checks, especially at the federal level, everything is going to come up, because there is federal law in other agencies that a criminal conviction in certain things will always be reported, but the federal government will always have access to everything. And I think that's really key for people to understand of how honest they have to be. Just because it happened, just because it was expunged, it won't be held against you. But part of the background is how honest you are as well. So I'll stop there and go ahead, turn it back over.
Thank you so much, DeAnna. I'm so glad you chimed in with that. And really, like you said, it's a key point to emphasize. And I appreciate the way you put it too. It's paperwork. You're filling out paperwork. It's not necessarily going to be held against you. Just, you want to make sure that you are just following the directions to a T. So just very much appreciate that you highlighted that. Let me jump back in here. And DeAnna, please, and everyone chime in. I'm sorry, I can't see when people are coming back on camera or has a hand up. So I'm going to keep going. So please cut me off if you have other places to add. So one thing I just want to make sure that another kind of key point here. So Pat, we had the point that this is being determined on a case-by-case basis. So your case will be looked at, you as an individual, not just about what you put on the forms. And so it's important to note that the hiring official, so not the person, so that your hiring official is the person who kind of eventually is going to be your supervisor. So you have this process going on where they're doing the background check. This is being run out of the Office of Security and Safety and Asset Management. That office is separate from most likely than not, unless you're applying to OSAM itself. But it's most likely they're separate from the office or the team that you're actually going to work with. And so OSAM the Office of Security and Safety Asset Management they're going to handle this process with you directly. They're not going to involve the hiring official. In other words, they're not going to involve the person who's eventually going to be your supervisor. So that's key. So when you will go through this process with OSAM and resolve it directly with them, and then when you come to CDC and you join the team, this will never have been brought up with your supervisor. So when you join CDC, your supervisor and the team you're going to work with at CDC will not have any any knowledge of if you have a prior history of justice system involvement, unless you choose to disclose that to them.
And that's a really key point, Ariel, too. I think that's a really key point for self-efficacy and different things for people to know once you're hired, it's a totally different department. It's up to you if you ever want to even disclose it. You don't have to in any kind of way. You were cleared to be suitable for the clearance that is necessary, suitable, having the knowledge, skills, and abilities for this position. Where it goes about your history is totally up to you at that point, but your colleagues and your supervisor will never know unless you tell it, because the office who cleared you does not share that information.
Yep. Thank you so much, DeAnna. And so, yeah, that's another key point there as you're thinking about coming to join us here at CDC. And so next slide, are you seeing a slide that says 5CFR? Yeah. Great, thank you. So when OSAM, so again, this is a different office. This isn't probably not going to be the office you're going to work with. You're going to have be employed in and have a position with. So the OSAM, when they're reviewing your suitability for employment, they use this criteria here for making their determinations from the Title V Code of Federal Regulations, Part 731, which includes criminal or dishonest conduct. But related to this criteria, in this same guidance, there's additional considerations in the guidance. So if you go to the next slide. So you should be seeing a slide that says additional considerations for suitability. So so these are some of the other guidance or other considerations that they're going to take into account when they're reviewing your suitability. So first is the nature of the position being hired for and its relation to the person's charges or convictions. Next is the nature and seriousness and circumstances surrounding the conduct, including a person's age or societal conditions at the time. Then recency of the conviction or incarceration. So longer time since incarceration is more likely to be favorable, as well as making sure your process is complete, so you don't have any ongoing charges or trial pending. And then the absence or presence of rehabilitation or efforts towards rehabilitation. And these are copy and pasted straight out of that, guidance that I just mentioned on the previous.
Also on this, Muriel, I think for the audience, I apologize for keep jumping in, but these are some really good points. These are also the considerations for suitability is also what the EEOC uses to say if a private employer has discriminated against a person with a criminal background, did they weigh these considerations into weight? And if they didn't, this is what they utilize to determine if an employer has discriminated against you based on your criminal background and those different things. So I just wanted to highlight that as well, that this is utilized also by the EEOC around employment discriminatory practices.
Thank you, DeAnna. And so, yeah, and kind of building on that, it's again, that idea that you have a history or you don't have a history. It's not really black and white like that. It's they're going to go through these considerations. They're going to take all these to account when they're looking through and determining your suitability. They don't just look at your record and say, nope, got a record denied. They're going to take all these factors into consideration and work with you on an individual case-by-case basis. Next slide. And so we learned that people with former justice system involvement can be and already are hired at CDC. And that's led our task force to focus on pre and post hiring. And so with the task force that I mentioned at the beginning, at the beginning of these slides, what the task force is currently working on right now is an inclusion and belonging strategy to create a sustained positive workplace culture that will increase retention and elevate the expertise of those with a history of incarceration. And then we want to develop a recruitment strategy to ensure that CDC is reaching a qualified applicant pool of persons with a history of incarceration for public health positions to assist with overcoming all the barriers, the perceived barriers, everything we've been discussing up until now, perceived barriers to hiring persons with a history of incarceration. Both are very important, but as there are many people with lived experience that don't think, there are people with lived experience that don't think they can apply for federal positions, but we also don't want to focus on recruitment and increase the number of people with lived experience only for them to be hired into a workforce that's not inclusive or maybe even be stigmatizing to them or doesn't embrace their perspective. So we also are really focusing on this inclusion part and making people feel welcomed and they belong here at CDC. And so the next slide, and this slide just has some resources from the Office of Personnel Management. And DeAnna, I'm so grateful for the additions that you've given as I've gone through kind of this lessons learned. And I'm curious if you have any additional considerations that you'd like to discuss, or any other tips or anything to add to what I just mentioned.
No, thank you for this. This has been really great, with the goal of demystifying this myth. But also, I think it was very important what you just stated on the last slide about it's one thing to hire people, but ensuring that they are in an environment that is inclusive and they are there based on their knowledge, skills, and abilities. And that's why the important factor paid attention that the security office clears you. And once you come onto your team, onto, your department, no one knows. It's up to you. I think that's because now you're there as a colleague and you never have to wonder about your criminal background, if that's the reason they got you in the door. If that's what qualified you, of course, for me, I was in a position that lived experience played into some of the decisions of how we were doing second chance grants, how we were actually expanding the grants around family reunification and all of that. But you may be in a position where you're an epidemiologist, you're working on something. It may not, but it's always up to you. And I think that was very important. So thank you for that.
Thank you, DeAnna. Just emphasizing, it's be challenging. It's competitive to get here to CDC. And so if you get here, you deserve to be here.
Yeah.
And so always keep that in mind. And I'll turn it back to you, DeAnna, for the next part.
Thank you. I know we're going to move to USAJobs, but you said something, Muriel, that was really important. And it was something someone said to me when I was doing the top secret clearance. And I always questioned why I was there, because I was in a room with neurologists and all these other people competing. And one of the commissioners stated to me, if you made it this far, you have the caliber to be here. And they're probably looking at you saying, how did they get here with you and your expertise? So I just want to let people know we belong, you belong. If you've made it through a process, you belong exactly where you are, because you are qualified and bring the knowledge, skills, and abilities that are necessary for those positions. I want to go to the next slide. And I want to come back to Neelam on this. So Neelam, Dr. Gia, and I'm sorry for being so personal, Dr. Gia, if you could come back on camera, because I think the user experience with USAJobs was, I had never encountered anything like it. I actually had to ask someone for some knowledge of how do I do this? How do I navigate this system? How do I know I'm doing it right? And now I can just go in there and whiz through it really quick, because you learn it. So it's a learning curve, especially if it's not a system that's out in the world that other people are using. It's unique to the federal government. So can you give us some key points about the employment portal and key pieces of information that applicants should be aware of?
I would love to, and thank you for sharing your experience. I love how you framed it, navigating this platform, because that's exactly it. And you learn by doing. And so let me provide some tips and tricks, if you will. So while you're trying to do it the first time, it will be more user friendly, if you will, as you keep applying for additional jobs, if you need to. All right. Next slide, please. So we're on how to apply. And before we even go on that platform, I do want to point you to some videos that we have on our own webpage, but that you could probably Google or find on YouTube as well, which is how to best to apply to federal positions via USAJobs.gov. And so you could see those videos down there as well. You can get them through our webpage, and I'll show that QR code again in case you missed it the first time. But again, these are helpful videos that before you even begin, I would recommend you review. That'll help you. Next slide. So here it is, USAJobs. So the first order of business is saving this to your favorites, bookmarking it to your computer, USAJobs.gov. And you want to first begin by creating your profile. And what does that mean? That is filling out information about yourself, and also uploading your current resume or CV, and including information about your degrees you've already obtained, and any certifications, other information like foreign languages that you may speak or are fluent in, things of that nature. So the other tip I have for you is have all of these things ready to be uploaded from your computer, such as college transcripts, CV and resume, as I mentioned earlier, other certifications, certificates. And so you can quickly pull them, upload them, and you're not searching, and then something goes wrong on your computer, and you miss that efficient opportunity to create your profile in one go. And so again, USAJobs.gov is what you want to save to your favorites, create a profile, have those documents ready to go to upload to create that profile. Next slide, please. And so then once you've created that profile, all right, we're on to the next step, which is searching for the positions. But then you say, well, Neelam, I don't even know where to begin. What is a GS level? How do I know what number to select? And so GS stands for General Schedule Classification of Positions. And as you can see on this slide here, the basic requirements for a GS 5 to 12 position is already have obtained a bachelor's degree. And for these other GS 7 to 12 and above, you can also have a specialized experience. So as you can see, let's just take GS7 for example. So you would need that 1 full year of academic year of graduate education or law school or superior academic achievement. And then the specialized experience piece would be the 1 year equivalent to at least GS5. So I hope that makes sense, but essentially equivalent combinations that you can see at the very bottom of education experience are qualifying for all grade levels with both the education and experience piece that is acceptable. And so if you want to find out more just about the various GS classifications, you can go on different web pages such as OPM's. There's there you go, federalpay.org, state gov, etc. And so let me see. So in terms of higher level grades, a GS 15 is like the highest. The lowest is GS 1. I should have started from that. So it ranges from GS 1 to lowest to GS 15 highest. And so how do agencies figure out which position they're going to classify? It is based, the grade is based in terms of the level of difficulty, responsibility, and the qualifications required to carry out that specific positions, right? Somebody essentially with a high school diploma, no additional experience would typically qualify for a GS2 level position, whereas somebody with a bachelor's degree may qualify for a GS5 level position, and those with a master's degree would qualify for a GS9 position to start off with. Again, GS1 through about 7 generally marks entry-level positions. The mid-level would be GS 8 to 12 range, and then the top tier would be that high GS level, senior managers, high-level technical specialists, physicians, and those would be the GS 13 to 15 range.
Nia, I think it's important too, because I know when I first got in, all of this made no sense to me, right? Again, it's government foreign language. So I think just for those who are attending, to make it clear that even if you come in with a high school diploma, no other experience, and you get in at a GS2, once you're in a position for a year, a GS2, you can always apply for GS3. So you can start moving the ranks, because the specialized experience category for each grade level, if you don't meet the education, it will say, or specialized experience of 1 year of the grade below it. So if you're at a 3 and you're trying to get to a 4, you could use that year of equivalent experience of a GS3 to get to the 4. And a lot of times career people move through the ranks in that manner, because you start gaining that experience with your years of experience in federal government.
Yes, thank you for clarifying. And the beauty of working at CDC is, as you said nicely, DeAnna, is once you get your foot in the door and you are there, you can navigate, and you don't even have to stay in the same area. You can pivot and find a next highest GS level position in another. Remember, I showed you that work chart, another center, office, or institute based on your skills. And so you can certainly do that. That's absolutely right. And in addition to the grade levels, there are steps. So if you do decide staying in that position, each grade has 10 steps. So steps 1 through 10. And so each are worth approximately 3% of the employee's salary. And so new GS employees are usually hired at that step 1. And then if you, again, stay at that position each year based on, for example, a really good end of year rating, et cetera, you would move up in steps. So I see the benefit in staying if you enjoy that work in the current position, or you have the opportunity, as mentioned, moving up to a higher GS level.
And I think it's also important, because Raynell put the GS schedule in there, for when people even look at that step 1 in a GS level they may qualify for. Something I learned that I didn't know going through the door, you can negotiate your salary with the federal government too. So I was new to federal government, so the initial offer was a step 1, but because I had 15 years experience, I was able to navigate not only through the steps that I came through the door, but also my vacation time, and not starting vacation at the bottom tier of a person who didn't have the experience. So I just want people to be aware of that as well, that although the steps are there, based on your years of experience you may have that you're bringing to the table, you can have a real conversation with your hiring manager around where you start, and they'll let you know. But again, and I think it's the first 5 steps, you increase every year automatically. And then when you get to step 4, I think you have to stay 2 years, and then you can move. I don't know if it's 4 or 5, but I thought to make that clear too, how you move through the steps automatically.
Right. I think you brought up a great point, which is there is no harm whatsoever once you have FaceTime with that hiring manager to sort of speak to your experience. And again, have that justification ready, have your elevator speech ready to say, I see that this was posted at this, stage or level. However, I bring X, Y, and Z to the table. I would be an asset to your team. Would you consider, bumping up to whatever the case may be? And they may go back and see what they can do, but sometimes they may say, unfortunately, we're capped because of our current budget for this position, whatever the case may. And then ask, what are the future opportunities? What is the future of this position in terms of leadership opportunities or moving up, any other openings in this area, et cetera, et cetera. So I would also encourage you to share that as well. Next slide, please. So now I want to actually show you examples of what these position announcements, as we call them, look like in USAJobs. So these are actually snapshots of real positions that were once opened. And so this first one, bear with me. This is actually one you would not apply to. not apply to. And why is that? Because if you look in the middle of this announcement and you see where it says this job is open to, this one actually is open to somebody that's already working at CDC because it says internal to agency. So, you know, I want you to be strategic. Yes, it is a numbers game, meaning the more you apply, the more, like, you know, what's the word I'm looking for? The more you apply, the better your chances are of hearing back about a position, correct? However, we want to be strategic here. And so we want to ensure we're going to qualify for the position that we're applying to. And so if you see something, if you see an announcement posted that says internal agency, you're not already working there, this is one you don't want to hit that apply button to, right? But I want to show you this because it does show some interesting information. So at the very top, you see the position name, public health analyst. Then under CDC, it says where in the organization this position is located in. This one is in National Center for Emerging and Zoonotic Infectious Diseases. So maybe you want to then copy that, go on our cdc.gov website and learn more about that national center, what they do, right? You can also see, of course, the salary range is important. The GS, the scale and grade is level to ensure that you're, again, applying for GS levels you would qualify for based on your degree and experience. But location is very important. Now, I will tell you, during COVID, a lot of what we call remote positions opened up, fully remote, meaning you would not have to relocate or move to Atlanta, Georgia, where we are headquartered. But then others you will see, like this one, it is here in Atlanta, Georgia. Now, the caveat there is recently you will see telework eligible. So maybe you are here in Atlanta, Georgia. You may have the option of teleworking from home within a 50-mile radius of Atlanta, Georgia, of the CDC. So as you can see, it says telework eligible, yes, as determined by the agency policy at the time. And if you have questions on that, if you get an interview, you can certainly ask. But I wanted to highlight those pieces of this announcement. So again, this one is open to the public. You would not apply to that. If you did, you would have to be located here in Atlanta, Georgia. Next slide, please. And so here's one. I think it's the epidemiologist one that's next. There we go. This one is a GS11. This one, remote job, yes, right? And then this one is actually in our center, NCHHSTP. This one is, the job is open to the public, right? So we would consider this one. Unfortunately, this job closed, and so at the top you can see hiring complete. But otherwise, you would see an apply button at the top corner. Next slide. And I want to just share, in our center, we do have many PhDs, med and epidemiologists who can either come in as a team lead or can even work their way up to be a team lead, again, specifically in our center. The next one here, as you can see, is public health advisor in our center, but this is a GS12 level. It is 100% remote. You would not need to move here, and this one is open to the public. So a good example of one. You could be a project officer as well in a public health advisor position. Next slide. I think I have a couple more to just quickly show you. Health scientist. Some health scientists can even be lab focused. Some can be evaluation focused. Extramural research, we have informatics, and data scientists can all fall under also the health scientist position. Gia, yes, please.
Really quick, I think I wanted to ask on the salary range, is that when it's 100% remote, is that based on DC, but the GS locality will be based on where they live, their place of residence, even in that remote position, or is it just straight baseline in these 100% remote?
I want to say straight baseline. Renelle, could you confirm that by chance? Otherwise, we could circle back.
Well, I was just actually just gonna post the OPMGS scale.
Perfect.
Like, you know, it tells you based on where you live what the salary is for each grade level. So I'll post that in the chat.
There we go.
Thank you.
Thank you, ma'am. That was actually a really good question there. That's helpful. So next slide. And I think one other example maybe to show you. Let's see. Oh, no more examples, but I hope those were helpful. And then as you can see here, this sort of outlines it a little bit better for you. So if you in particular, our audience here, majority of you are GS 13 or 14 sort of level with education and experience, you can see here that some of the duties of a position you may be applying for could include experience planning, conducting and analyzing scientific studies or surveys related to public health programs. Now at a 14, now we're talking about leadership level, supervisory and management level. You would already have that GS 13 under your belt within the federal government. And so again, as you can see the difference between these qualifications for even just one GS level apart, the 14 highlights leadership, development, implementation, so sort of high level, big picture. Next slide. So in terms of resume recommendations that the resume you would be uploading to USAJobs, it's really, again, all about how you highlight yourself in writing there. You really do want to speak to what the GS level you are applying for requires, so that when that HR check happens, they can say, check mark, you qualify for this position. You go on to the next phase of this application period. So if somebody's applying for that, again, GS level, they already have the GS 12 stuff under their belt. Now they're into developing the programs and policies, right? Analyzing the reports to make informed decisions about programs. And they have specialized skill sets as well. So again, these are just some examples and recommendations. Next slide. And in terms of competencies and how you will be evaluated, they sort of review your resume and those supporting documentations. Remember, you added a part of your profile when you stood that up in USAJobs. And then they will sort of do a cross-check between those assessment questions that they ask you for each position to see if you qualify. And so they really look closely at your resume. This is how she or he answered this question, but yet this is what they indicated on their resume. It's matching up, maybe it's not matching up. And so just know that your information is reviewed and it is cross-checked with the documents you upload, how you answer these questions. And the questions really try to get to if you are knowledgeable in the area, if you have the specialized skills, you have the abilities, did you do this before? And other characteristics. So of the position that you're applying for, that the hiring manager is looking for, that they think if they hire a person with these skills will best carry out that position's roles on their team. Next slide. In terms of those questions, we actually recommend following, if you haven't heard these before, the STAR or CAR method. And that is when you're answering these assessment questions, talk about STAR, S, the situation. What is the problem or challenge that you faced? T, the tasks that were involved. A, the action that you took. What did you do? And then R, the results. What impact happened because of your efforts? And or you could choose the CAR method. So C, again, talking about the challenge, then the next C, providing context around that. A, again, the action, and R, again, the results, including impacts. So again, answering those assessment questions for each position, utilizing either the STAR or CAR method to answer those will really help you and really help HR when they're doing this review, human resources that is, ensure that you are the best fit for this position. Next slide. Into hiring authorities. So what is a hiring authority? It's a law and executive order regulation that allows an agency to hire into the federal civil service. And agencies may use a variety of these hiring or appointing authorities to hire applicants. And Schedule A, as you can see here, is for persons with disabilities. There is a direct hire authority, and the name is escaping me. I feel like it has the number 12 in it, but that is that doesn't happen very often, but some hiring managers are open to, for example, collecting or reviewing resumes from non-US citizens if they have the specialized skill that their position opening requires. And then there's veterans hiring authorities. And then we have other programs such as pathway programs, including the Presidential Management Fellow. And I actually want to share with you here in a little bit some other fellowship opportunities. I know we got the question in the chat, how can I sort of join CDC or the federal agency and get some experience before I maybe apply to a full-time position. So I want to share a couple of those opportunities with you later on in the presentation. Next slide. But before that here, and I think Dr. Miles might be dropping in some of these links in the chat. Here are some hiring resources. Can even take a picture of this or type it again in Google, and there's some on YouTube that could pop up that would be good to reference based on what we shared here today. Next slide. So I wanted to circle back to this slide because, as mentioned earlier, this is the application process for you in a nutshell. And so again, we have gone on USAJobs.gov. And the reason I say save it to your favorites is so you can continually, whether it's on a daily basis, weekly basis, go back and just keep checking and searching for positions, or you can let this platform do the work for you. You can actually set up searches. And you'll have to play around with this, but you can certainly do it, and you can let them know, hey, USA Jobs, ping me, meaning send me an email, if a position in Atlanta, Georgia opened up at the CDC in the National Center, and it will send you that information. But then once you are searching for these positions, review that entire announcement carefully, just like we did, to ensure that you would qualify for what you're applying for. Answer those assessment questions the best you can, being transparent, being honest, ensuring it matches up with what's on your resume and the other documentation. Make sure you do upload and that information is current, that you have uploaded those documents, and then it's essentially a matter of having HR do that first review and check to see if you qualify. You will get a notice of where you stand or where that position stands in terms of have they selected anybody? Have you been considered for it? You will eventually get notified where you are in the process of that applying for that position. That's the notice of qualification review, and then the notice of results. Next slide. So quickly, I want to touch on some interview tips if you get to that level. Speaking of being notified, if the hiring manager reaches out to you, next slide, and they want to interview you, usually they occur in either the phone format. Lately, again, it's been virtual via Zoom or MS Teams. The first of maybe 2 or so interviews consist of first a panel of people that may include the hiring official, which eventually would be your supervisor if you would be selected, and then colleagues from the agency and specifically in that office or center and maybe even on that team. And that first interview with the panel of colleagues would be used to learn a little bit more about you other than what you submitted through USAJobs. And it is for them to be able to narrow down the applicants that they have selected to then have a second interview. And usually that's two people and between just a couple narrowed down to a couple of applicants, right? And more specific questions, and that's maybe even opportunity for you to be able to ask any specific questions that you have. So that's sort of how the interview flow goes. Next slide. Here's where I want to chat with you about other opportunities and ways to gain experience, like the chat question asked. Next slide. I'm going to highlight just a couple, but if you'd like to learn about all of them, you can simply Google CDC internships, CDC fellowships, and all of them will come up. Thank you, Dr. Miles dropped it in the chat as well, the links. And so the two I'd like to highlight for you today include the Public Health Associate Program, or PHAP for sure. I actually serve as a mentor, CDC mentor for this program for many years. And then the other is the Epidemic Intelligence Service, EIS. Next slide, please. So the first one, the PHAP program, this is such a wonderful opportunity to provide for early career public health professionals to get hands-on experience working in public health agencies and organizations across the company or across the country, excuse me. This program strengthens the front line of public health systems and builds the next generation of skilled public health professionals. Just to give you a real-time example, my current PHAP mentee is lives in Atlanta, Georgia, but through this program, she has been working with the Austin Public Health Department in Texas, doing amazing work already with her colleagues there. So this is a training program, not a fellowship, by the way, where you can acquire public health knowledge, skills, and abilities through the program with hands-on experience. So I won't go much further into this next slide, but here's the contact information if you are interested. It is a 2-year competency-based training program. It does not guarantee federal government employment once you complete the program, but it better positions you for applying to, for example, a full-time position at CDC. Next slide. The last one is the EIS program, as mentioned, and I'm sure you've all watched the news and heard of, for example, people getting sick in the community, whether it's a foodborne illness, a waterborne illness, and this is where CDC staff, specifically EIS officers, in addition to lab staff and others, go out to the affected area to sort of solve the mystery. And so we call them disease detectives. And if ever you watch the movie Contagion, that was Kate Winslet. That was the role that she played, was an EIS officer going in the field, as we say. So anyway, the link again is below if you'd like to learn more about this training program as well. Then the next slide, I will show you our QR code that has those videos about how to best apply for USAJobs, has our open positions listed specifically in our center, and just other, links to the fellowships and other opportunities I mentioned. So feel free to put your phone up to this QR code or take a snapshot of it later and then save that to your favorites. I think I saw something in the chat about it might have not gotten directly to that site, but it redirected. Just click on that redirection. And the reason is, apologies, CDC is doing what they call a clean sweep. So they're redoing some of their web pages, but the content is still there. So hopefully click on redirect and it'll take you to the right page. It may look a little different than what we're used to seeing, but the content is still there to access. Finally, if you are here, yes.
Oh, great. You guys can hear me. Neelam, do you mind if I jump in real fast?
Yes, please, go ahead.
Just putting a plug in, I remiss if I didn't, that we have 2 open ORISE fellowships in Renelle and I's office, the NCHHSTP Office of Health Equity. So if you're interested, it is a master's or doctoral level fellowship, but if you're interested to come work with us in our mission to promote health equity and reduce health disparities among populations disproportionately affected by HIV, hepatitis, STDs, and TB, come work with us. And I think Renelle's going to post the fellowship in the chat.
Perfect. I was just going to ask her to do that. I mean, imagine the opportunity to work with Dr. Marlowe and Dr. Miles. I can attest, really great colleagues who work on important work there. Dr. Marlowe mentioned ORISE Fellowship. That is another opportunity. Again, if you go to cdc.gov/fellowships, they will also, that one will also appear along with many others. I think if you're going to look through fellowships, please ensure that you're looking at the open application period. They're all over different months of when to apply and when things close and how to apply to them. And then the qualifications for those, because there are several. They are competitive, but I would encourage you to look at those as well, in addition to our full-time employment opportunities through USAJobs. And yes, it's posted now. So in the next slide, I was just going to close my portion by saying, if you're here in Atlanta, Georgia, please stop by and see us at the CDC. We actually have a visitor center with the museum you can learn more about what we shared with you and about the CDC, our disease detectives, and other important things we have worked on. So in case you didn't know that, there you go. Thank you so much.
No, thank you. Thank you to our amazing panelists for joining us. Raynell, Muriel, and Neelam for sharing this valuable information. Just a couple of things. I know we had a couple of questions and we have 5 minutes, but there were a couple of things that I just really want to ensure. I know as you're talking about the various grade levels, the positions that are available, that I was in that situation where I wasn't quite sure, because a lot of times in my mind, I put the federal government at this level, and what I was doing, I felt was grassroots, but it was simply the core competencies. And me and my team are really planning for a speaker series, not only with Office of Personnel Management, OPM, but also on our resume, because what we've discovered, even at Just Leadership and working with some of our federal partners, is individuals' clear understanding of how to pull out core competencies for the positions they're applying for, so they can make it out of that portal. So it does, we know a resume is a brochure, right? Your resume gets you to the interview, but then when you're at the interview, you answer that one question, tell me about yourself. And that's really, tell me the things that aren't on your resume, which talks about those core competencies are very important. And I was laughing when you were talking about it, because I remember I had to think back, and this was leadership positions I was applying for at the federal government, GS-14, and it went all the way back to when I worked at the state of Indiana and I oversaw a project. And I implemented a project across 7 counties around substance abuse and criminal justice. Those were core competency skills when you start talking about the STAR of what was the situation that I actually identified in Indiana, even in my hometown of Cincinnati. There was no infrastructure for reentry for people returning from incarceration to community. So what was the task? The task was, one, to remove the stigma so that resources could start flowing, Then what was the action? I built a reentry coalition. I convened the table of all stakeholders. And what was the results? We were able to ban the box on county applications, city applications, and state applications. We implemented a reentry structure for people returning to our community who had outstanding child support warrants that they weren't arrested. So when you look at grassroots, I want to make sure people don't think the stuff they're doing on the ground doesn't apply. You're doing this work. Raynell, Muriel, Neelam, I want to give you, if you have any last words of encouragement to everyone who's listening today, and then I'll wrap it up from there.
Yeah, Dan, I have, this might actually not be encouragement, so to say, but applying to the federal government is a long process. So if you put an application in, it could be months until you hear something back, or it could be sooner. But just know that if you start applying for the federal government, you're not hearing back immediately right away, that it's a long process. It takes some time. And then I was just kind of, as I'm hearing you, DeAnna, speak, you're saying, I implemented, I convened, you know, yes, pull all those words out, make sure the resume and consider the first person the first wave of applications when they review applications in HR is not the person who's hiring you. It's, right, you know, the supervisor whose team you're going to work on, who knows the expertise they want, is not the person reviewing your application. So make sure it's just so clear in your application, why you are qualified. You know, just as DeAnna was describing, put all those things in your resume. Make sure they're very clear to anyone that you are qualified for this position. Hope that made sense.
Yeah,
over to my colleagues.
It does. It really does, and it's really important. And again, how to do a federal resume. I thought it was how to do a federal resume. I realized it was how to do a resume, because, you know, we teach in our leadership training at Just Leadership. Once you make it to the pivotal point where you actually aren't looking for jobs, jobs are looking for you. That's because your resume has been out there and people actually know what you're bringing to the table. And that's the ultimate goal that we want to get to in our life around searching out career opportunities, that opportunities come searching for you. You no longer have to go searching for them. Neelam and Rael, do you guys have anything, closing words for our listeners today?
I'll just echo what Dr. Miles said, and I'm looking at the chat. Somebody said so many times we're afraid of the opportunity, not having confidence in who we are. Listen, toot your own horn. You know best what you did. Highlight it to the max. It's about using strategic word. You analyze this, you led this, you convened this, you oversaw X number, you know, add those impacts, add those numbers, let it speak for you. And then when you get to that interview, just shine, right? And it's a two-way street. Please remember that you are also interviewing them. Is this the best fit for you, where you want to showcase your talent and skills? We would love to have you join us at CDC, and specifically our center. Please take time to review our opportunities. You're totally worth it. And if you don't get discouraged, as Muriel mentioned, it may take you one time, it take you 100 times, but once you get there, you can navigate, move around, and move up and make a difference in public health in our community and maybe around the world. So thanks again.
Thank you, Raynell. I know you have some words for them.
Yeah, you know, I just mirror what everybody has said, but I think one key takeaway, if you reverse what Muriel said about 2% of people being denied after they've been selected, 98% of people that are selected who have a criminal history or a record or history of incarceration are still accepted for employment. So don't feel discouraged. It's just entirely possible that you can work here. So
thank you.
Yeah.
Muriel said something about the process being long, and I just kind of want to wrap up with this. I remember I applied in August of 2015. I was called for an interview in October. I think I did my second interview in November. And by the time I cleared everything, I did not start at the federal government until July. So just understand, it is a long process, but it is so worth it. As we come to a close, I want to thank my guests for being here today. valuable information that you gave everyone. I am confident people are going to start searching USAJobs, looking for how they could fit in. Hopefully tuning in to further speaker series where we talk about resumes. All resources from today will be posted on our website for you guys to go back and utilize. And if you're not a member of the JCC, please join the JCC so you can be up on the information, valuable information that we're ensuring that we're bringing to individuals so that they know they have the access. I just want to close with this. And it was something that I thought about as Neelam and Raynell were speaking. A lion never asks for permission to roar. Its only job is to be the king of the jungle. I need everyone listening today to own your greatness and go out and rule your area. Thank you for joining us today. Bye.